We're going to finish our slides on the foot and the ankle with talking about bone injuries, okay? There's just a few that we're going to cover. There's tons and tons and tons of different types of fractures that can occur in the foot and ankle, but we're just going to talk about a few. So the first one that we're going to talk about is the fifth metatarsal avulsion fracture. Now, reminder, an avulsion fracture we've seen before. Okay, an avulsion fracture is referring to either a piece of the tendon or a piece of the ligament pulling off a piece of the bone with it. All right, so it's one of those injuries where you have damage to the soft tissue, whether it's the tendon or the ligament, and you also have the damage to the bone. Okay, so with this fracture, we are talking only about the fifth metatarsal, your little pinky toe. Okay. This fracture is known as a Jones fracture. Okay, it's much more commonly referred to as that. All right. We get this if our foot is forced really, really hard into inversion. Okay. Sometimes we can get this if you are running and your feet get caught up underneath you and you force that foot into inversion. It is very, very painful. You are going to usually have that pop or snap sensation because that bone has been pulled away from the other part of the bone. There's going to be a lot of pain, inability to move, especially in eversion. Okay. Our treatment is going to be to refer to a doctor. Okay. They will take it from there, but sometimes you have to be put in a cast, okay? Icing and protecting that area, doing those Price methods are going to be the first thing you do as you're getting them to the doctor. So this is showing you right here that fifth metatarsal, okay? And everybody has a little part on the very end where the bone kind of sticks out a little bit more. And some people it's going to stick out a lot, and some people it just sticks out a little bit, okay? And sometimes you really have to feel for it. But right here where this sticks out is where those perineal muscles that are on the lateral side of our leg attach. And so it's those perineal tendons that end up pulling off part of that chip of the bone when they're injured, okay? And so this is right here where we're dealing with the Jones fracture. Our next injury is the epiphyseal injuries of the distal tibia and fibula. Epiphysis, remember, is talking about the growth plate, the ends of those long bones. So because we are dealing with the foot, ankle, and lower leg, we are talking distal, okay, not up towards the knee. But we can get this if the patient is forced into plantar flexion or forced into inversion, okay? It usually takes quite a lot of force, okay? They're going to be hurting along those malleoli, all right, your lateral malleolus or your medial malleolus, and it's going to be very uncomfortable for them to walk. All right. You do need to send them for x-rays, especially if you have an athlete that is still growing. We definitely don't want to leave any fracture uncared for, but if you have a fracture to the growth plate, that could affect the way they grow in the future. So looking at our slide here, this is showing you the fracture right here where it should be connected. This is our medial malleolus right here. And this part is no longer connected. That growth plate has came off. All right, sending them to the doctor for x-ray so they can be splinted and monitored from there. Our last bone injury that we need to know is a stress fracture. Okay, we've heard about stress fractures before. They're also called fatigue fractures. And remember, we get these from overuse. Well, our lower body is going to be overused a whole lot more because we're walking on it every single day. If you're an athlete, you're running, you're jumping, you're doing all those things. One thing that's kind of key when we see a stress fracture is that you usually have more pain that is worse at night after you've had your activities, less right in the middle of your games or your practices, okay, which is something kind of unique. Signs and symptoms, there's could be some swelling, okay, there's a couple exams that we could do to help figure out, but the biggest thing is going to be a bone scan, Okay, and I'll show you what that looks like. A bone scan helps you to see where the extra activity is going on in the body. Okay, an x-ray will be helpful, but sometimes if the fracture is kind of new, you won't see the it won't show up on the x-ray like it would show up on a bone scan. So if you have a stress fracture, it's usually complete rest for a month. All right, that's no activity. It could be put in a walking boot, on crutches, definitely as off that body part as possible. Okay, here's what a bone scan looks like. Okay, you can see all those itty bitty little black dots everywhere. Okay, well, where it is darker, that's showing where there's more activity. Okay, so you can see on this foot right here, there's a big concentration of black dots, and that's going to be a common place for a stress fracture along those metatarsals. You're going to see it a lot in your ankles just because of your weight. All right, it's how your body is built, but we are really concerned right here where those big concentration of the black dots are. All right. So that concludes our bone part of the fractures. I will record the next video for tomorrow.